Hello everyone, welcome back to the channel. And I am Kirti Swarna, a speech language pathologist at Stammering. Today, I'm again going to solve few of your frequently asked questions. What are fluency disorders? Also known as stammering, cluttering or stuttering. In a fluency disorder, the flow of your speech is interrupted by blocks, repetitions or prolongations such as toast or match or parrot. So these kind of disfluencies disrupt your flow and can also lead to avoidance behaviors and secondary behaviors too. In India, the prevalence of stuttering or any fluency disorder is 10% compared to other countries, whereas in other countries it's around 0.75 to 1%. And only 45% awareness is there. Only they are aware of their problem and can get treatment, whereas the rest 55% are not aware of the problem and so they can't reach out for help or attend therapy. So if you notice such problems in your speech or such features or behaviors, kindly go meet a speech pathologist so we can help you. So moving on, how do I know what type of disfluency or fluency disorder I have? Well, a speech pathologist will be having certain tests to differential diagnose or to differentiate between your problem. So in case you have certain features such as blocks, repetitions and prolongations, they fall under the category of stuttering. And if you have other problems such as fast rate of speech, may or may not have any disorganized language or learning disability with no regard to reduced intelligence or a bit of hyperactivity, not awareness of the problem, or there might be temporary correction when someone says like, no, you're speaking too fast, please correct your speech, or slow down or pay attention. There might be a temporary fluency present, but after that it's back to the same rate of speech. So, or maybe your auditory perceptual problems are also arising, then this may lead to another fluency disorder such as cluttering. So people often get confused between cluttering and fast rate of speech. Fast rate of speech generally occurs when a person is speaking at a very high rate, so the sounds are not pronounced or stressed properly. So for example, if I want to say the sentence, I had an avocado toast for my breakfast, it would go like, I had an avocado toast for my breakfast. So because of the fast rate of speech, the sounds are not produced properly. So it is always advised to go meet your speech language pathologist so they can run a proper test and assess and find out what type of fluency disorder you have. Particularly in children, if you notice that these disfluencies are pertained even after 6 months or they are very severe in nature, it is better to start intervention as soon as possible. How do speech therapists help with social anxiety and public speaking? Well, for a fun fact, we do have expertise in that area. Firstly, when your profession demands a lot of addressing people on daily basis, giving numerous presentations, interpersonal communication skill has to be one of your strengths. So to improve that or to make it better, you can approach a speech therapist who will make a personalized plan after assessing your fluency, voice quality, your body posture, or which comes under non-verbal communication. So even in public speaking, when you speak, your fluency, your diction, your accent, the way you pronounce sounds, the way you stress correctly at right parts makes a huge difference. So a speech therapist will be looking into all of those aspects or all of those features. And when it comes to social anxiety, she might give you some calming techniques, or he or she might give you some strategies in which you can bring in the confidence to go and speak in public or be comfortable in a social situation. People around me have brought it to my notice that my voice has changed. What should I do? A change in voice quality can be because of various reasons. maybe vocal abuse, especially in professional voice users like teachers, singers, lecturers. They get to use their voice a lot. So because of that, that could lead to a bit of vocal abuse. Then maybe any organic cause, any structural changes, any functional changes, or maybe there's a vocal nodule, vocal polyp. There are various reasons. So the speech therapist will do a detailed assessment, perceptual and instrumental, to find out the nature and degree of the vocal problem. And then after that brief assessment, he or she will be making a personalized management plan for you. They'll be designing the particular vocal exercises that are in regard to your problem. And there's a fun fact: speech therapists also help in vocal training for singers. Like, they help them to increase their vocal quality, the dynamic range, the pitch range, and even increase the vocal endurance. So basically, they help them use their voice to the maximum potential. So moving on, my father has recently suffered a stroke, and ever since we have noticed changes in his speech. It feels like he's training himself to say the sentence, "What can be done?" Well, post-stroke, a patient can face various neurological communication disorders, maybe disorders with voice, and even respiration, swallowing disorders, which we call dysphagia. So let's just go through few common disorders like dysarthria. In dysarthria, because of the weakness of the oromotor muscles, they won't be able to produce speech, or it won't be that precise or intelligible. And we may perceive their speech as slurred speech. Then we will feel they are putting a lot of effort due to the reduced respiratory capacity. And we will perceive their speech very monotonous due to the restricted dynamic range. And in aphasia, they could be loss of language. It will be difficult for them to even understand simple sentences. They might find it difficult naming objects, like this is a plant, this is a laptop. It will be a bit difficult for them. That's it for today, and thank you so much for watching, and I really hope that this video has helped you. Please don't forget to like, share and subscribe to this channel.